clinical extern at the Cancer Wellness Center. Been coming up on a year. I'm in the third year of my doctoral program in psychology, so on my way to becoming a licensed therapist. So we've got a lot to cover, so I will not take too long and just get started, jump right into it. But I do want to say that since I am covering a lot of material, don't worry about like taking notes or feeling like you have to write everything down. We'll send out these slides so that you can just kind of focus in and not worry about trying to get everything down at once. And like Lisa said, we'll have a Q&A at the end. If something comes up as you're listening in, feel free to type it in the chat, or you can save it at the end for the Q&A. But like she said, I won't address any questions unless she interrupts me to bring my attention to something. So yeah, today we're here to talk about managing some fears of recurrence. And we're going to be going over a lot of different kind of stress management strategies, getting some practice in, and learning about kind of some ways to calm anxieties as they happen, because as I'm sure you all are aware, they happen a lot with recurrence. And so we can just get started there. Fears of recurrence are really normal. You're in a time in your cancer treatment journey when you're not really seen as much by your care team. You're not in active treatment, so there's not that like quote unquote protection flowing through your body the way there is when you're in chemo or getting radiation or taking oral meds. And you know what it's like, how painful it can be to get those scan results back and have them be, not exactly what you'd be hoping for. So that fear is real, and it's based in something that you've had previous experience with. And of course, whether you're a fan of looking things up online or not, it's hard to avoid some of those numbers of, your specific type of cancer's recurrence rate based on what stage you are, what age you are. And you can't help but focus on like, what side of the statistics am I going to be on? And that starts to show up in a lot of different areas of your life. You might just feel an ache or a pain one day and start to fear the worst is happening. And you're wondering, should I call my oncologist for this? Should I not? Do I reach out through the portal? That's a really, really normal experience. It's something that most all people go through. And, there are times specifically when this starts to become more and more prevalent too, right? Which is what we call scanxiety, which is very real, although the phrase is a little bit fun. So you might notice that these fears really start to creep up when you're around the time of a scan. So you might be getting those scans less often, but when they come around, you start to notice that you're feeling a little bit nervous, you're feeling worked up, whether that be before your scan's coming up, you start to get that notification, that reminder that your appointment's coming, and you start thinking about it more throughout the day. You might be in the test and really stressed out, worrying, or you might be waiting for your test results, kind of like constantly checking your phone, right? Or all the above. And scanxiety can look a lot of different ways, kind of like I have already touched upon, but it can feel physical. You might not have much of an appetite. You can feel your heart racing when you're sitting in the doctor's office. You might feel a pit in your stomach. You might have some behavioral symptoms, which is what I was talking about with that, like constantly checking your phone, right? Looking for that call or that email that your portal was updated. You might feel some emotional symptoms like irritability with your loved ones or just general low mood around the time of your scans. And then, of course, cognitive symptoms where you're feeling those racing thoughts, fearing the worst, thinking what's going to happen if my scan comes back and shows something has grown or spread or come back. These are all really common experiences around the time of that scan, so much so that we have a phrase for it. But the way you feel during these times is kind of really variable by person and by scan and situation. There are a whole host of emotions that come up during this time, and any combination or number of these emotions is completely valid and understandable to experience. Some of the most common ones being that fear, that anxiety, that relief, that treatment's also over for the time being. And right now you have no evidence of disease. You might feel frustrated with your body for kind of feeling like it's working against you. You might feel guilty for all of the support that you've gotten. You might feel depressed and feeling like I'm supposed to be happy right now, and now I'm not. And I'm nervous and I feel like everyone has moved on and I haven't. And you might also feel a little bit hopeful, right? Sometimes that can be the hardest thing to acknowledge, is that you are hoping that your cancer is going to go, stay away. And so any combination of these emotions makes total sense. And these negative emotions are also important to experience as well. There's a lot of ideas about the power of positive thinking. And while that is important, it's also good to express those negative emotions. There is no scientific evidence that negative emotions cause cancer. So if you're feeling frustrated, if you're feeling anxious, it's okay to express that and experience that rather than try and shove it down. But while these feelings are normal, of course, you don't want to be consumed by them. That's when we start to think, maybe what can we do about this, is when you're thinking about it day in and day out. You can't sleep at night. You're constantly feeling on edge. Your body feels tense. And so these are signs that you might need some additional support during, whether it be during a scan or just you're feeling it day in and day out. That kind of intensity of the feelings is kind of that sign of when you're going to need additional support. And yes, this might be like professional support, but it also just might be telling other people in your life how you were feeling. Like I said, bottling it up isn't any better than trying to be relentlessly positive. It's really important to talk to loved ones about how you're feeling. Although I can understand why some people have hesitations around this. Your loved ones have been supportive of you throughout the experience, and you don't want to scare them. It feels like you need to keep your fears from your loved ones. And like I said earlier, it might feel like everyone's sort of moved on. And so, it's okay to let them know that you actually haven't moved on. You might be done with treatment, but that doesn't mean that you're done with cancer. Something's gonna, stick with you for a long time. It's not just no evidence of disease. We can pretend like it never happened. It's something that you still think about. And it's okay to let your loved ones know that you still need support, even though currently you might be no evidence of disease. The reality is that your loved ones probably are having some sort of fears of your recurrence as well. Of course, they want you to stay healthy. They want you to be well. So it can be nice to get it out in the open so you can discuss it together. I very much doubt that if you were to express your fears about recurrence to your loved ones, they would think that they would say that they've never had that thought before, right? I think fears of recurrence are pretty natural, and it just doesn't help for anyone to bottle it up inside. So sometimes this level of intervention is kind of enough if you're feeling really worked up. Sometimes just getting support from a loved one is kind of does the trick. But of course, sometimes you need additional professional support as well. It's also important to remove expectations for yourself during this time. In all likelihood, you're not going to, have your last day of chemo or radiation and just be like complete uphill trajectory from there, right? There are going to be days where you feel better and some days where you feel worse. Again, thinking about that scanxiety, you might be feeling like, really low anxiety, feeling really hopeful about the future. And then you get that notification on your phone to check in for your appointment. And, you might have a few days where you're feeling really bad, and then you might feel better again after you get the scan results back. And that's completely normal. There's no one path of, emotional recovery after cancer. It changes constantly as you might have follow-up appointments, scans, anniversaries of when you were first diagnosed or your date of last treatment. These are all times that you might feel that fear, closer to heart than you might on just like another random day. And I think it's important to have a conversation with yourself of, is it realistic to have no fears of recurrence? of course, that would be our goal for everyone, is to live completely free of recurrence and fear of recurrence and just live happily ever after cancer. But is that a realistic expectation to hold for yourself? Maybe it is for you. I don't know. But I think it's important to have that sort of conversation with yourself and, I can understand why I'm feeling this way. I sat in this exact chair a year ago when my doctor told me that I had cancer. And so it's understandable that I'm going to sit here and feel the same way, and have empathy for yourself as, your feelings change and you have some of those more negative emotions. Um, you know, I think the goal more realistically would probably be to kind of turn the volume down on those fears so that they're not so loud that you can't hear anything else around you, so that they're not consuming your day to day. I think would be a more realistic goal for most people than to have absolutely zero volume, no fear of recurrence whatsoever. So that's important to keep in mind too, is these stress management strategies, these anxiety dialogues that we're going to go over. The aim of them would be lovely if they brought your fears down to zero. But for most people, they're going to help. They're going to chip away at that anxiety, but they might not completely take it away, especially during those really more high anxiety times like scans. So the worry tree is one of these anxiety kind of dialogues that I was talking about. And I love this tool to think about, what sorts of anxieties you're experiencing, where your worries are coming from, and what you can do about them in the moment. So in looking at this anxiety tree, right at the start, you look at, what am I worrying about, right? And then, is this something that I can do about? Sometimes it's going to be yes, and sometimes it's going to be no, which, right, the tree wouldn't exist if that weren't the case. Sometimes it is a worry that you can do something about. And so you go down and you see, can I do it right now? If it's something you can do right now, go ahead and do it. And if it's something that you can't do right now, schedule it for when you can, when it's more appropriate to do. And then, of course, as we know with cancer, there are many things sometimes that you can't do anything about. And that's that time for those stress management strategies, for that breathing and letting the worry go. So this can be a really helpful tool when you find yourself worked up about something. So let's say you have a scan coming up, right? And you're worried that it's going to show that your cancer came back. So what are you worrying about? You're worrying that the scan is going to come back with bad results. Is this a problem that I can do something about? You already had the scan and there's really nothing you can do about it now except for wait for the results. So right now you're going to focus more on stress management strategies and you're going to let the worry go. And for another example, what am I worrying about? I am worrying just more generally that my cancer is going to come back. Okay, what can you do about it? Well, we're going to talk about various things that you could do, but let's say, for example, you are finding that you're not getting a lot of sleep and you're getting really stressed out all the time. Might be worth thinking, like, what if I set a healthier bedtime? That's not going to stop recurrence from coming back, but it's something that I can do to try and control it. All right, I'm going to do it. I'm going to set a bedtime schedule, and then I'm going to let that worry go. So it's about finding that realistic balance and kind of that evaluation of, is this a worry that will lead to productive action? Or is this a worry that is just kind of unproductive and is sitting there and I need to let go? So to do a little activity, I won't ask anyone to share, so don't worry about making it something that others will read or see out loud. But I just want to take just a few minutes for you guys to walk through a worry tree for yourself. So it doesn't even have to be cancer related. If cancer is not the number one thing on your mind right now, this can be applied to anything. Just kind of walking yourself through, what are you worrying about? And then kind of walking through, is this a problem you can do something about? If so, what is it? And can you do it right now? And if not, breathing and letting that anxiety go. So I'll give you guys just a few minutes. You probably won't need 5 full minutes, but I'll give you guys just a few minutes to choose a worry and kind of walk yourself through the worry tree. All right. I'm sure most of you have gotten yourself through your tree. You can see how quick of an activity that is, right? If you find yourself just in the middle of the day, all you really need is max 2 minutes to kind of get yourself through that tree. So it can be a really helpful exercise in trying to figure out, is this something I can do right now, or is this something that I'm going to need to utilize something else in order to kind of get it off my mind? And what that kind of comes down to is the idea of productive versus unproductive worry. So, like I said, the main focus of that worry tree is to focus on what you can control and try not to get caught up in what you can't. And nothing tests your ability to do this like cancer, because there is so much uncertainty. There is so much out of your control. And there's a lot of different information out there, right? You could look up an article on sugar and cancer and find evidence that, yes, absolutely, sugar and cancer are linked. And then you could also find an article that says, no, absolutely not. So there's a ton of information out there. And so even something that feels like we can control it, we're not even sure if that's even going to have an effect. And it causes a lot of anxiety to feel like, am I just supposed to sit here and wait? What am I supposed to do? So the anxiety tree can be incredibly helpful in kind of figuring out, is this something that I can take action on and make a nice change? Or is it something that I really am just going to have to move on from and find a different way to kind of get around this? I also am always careful to note that productive worries can also turn into unproductive worries. And I think something like sugar and cancer is the perfect example of that. Yes, you can limit your sugar, and that's probably good, not just for cancer, but for your general health. But if you are trying to manage zero sugar, natural or artificial or anything all the time, that's going to start to probably get in the way of how you're living your life. You might not want to go out to dinner with friends. You might, be really craving ice cream one night and just kind of denying yourself that simple little pleasure that's going to improve your mental health. And that's when that can start to get kind of out of control in a way where, so even with our productive worries, sometimes we have to manage them in a way where moderation is always the key, because they can, become unproductive worries based on the extent of our control. Like I said, we don't really know the link between sugar and cancer just quite yet. So there's only so much we can control within even that activity. And that's super important to keep in mind, because that can cause just as much, if not more, distress of fears of recurrence if you're trying to set expectations for yourself that aren't manageable and start to get in the way of good things in your life too. So now we're going to kind of shift into what can you do about it, right? I'm sure you guys could have just given that talk yourselves. You all are very well versed in fears of recurrence and what they feel like and how hard it is to, talk to others and experience this anxiety. So now we'll get into more of what you can actually do about it. Some practical steps. I always tell everyone who is moving into the post-treatment phase to ask your oncologist what symptoms are worth reaching out to them about. Of course, there might be some gray area and things. It might not be an exhaustive list that they give you, but they might be able to provide some sort of structure. And, an ache in your leg likely is not going to be a concern. But if you're finding that your heart rate is consistently elevated, that's something that you're going to want to reach out about. Whatever it may be for your specific type of cancer and health history, having your oncologist kind of lay that outline for you can really help to reduce that anxiety when you feel that random ache or pain, or you get a cold on a random day and you start to worry about, could this be a recurrence? Of course, scheduling annual checkups and routine scans like mammograms, blood tests, pap smears, whatever they may be. For Scanxiety specifically, asking when you might expect the results of your scan and how they're going to be delivered, whether that be they're going to give you a call or they're actually just going to have you wait here and give you your results right away, or you have to schedule an appointment to come back and get the results, or they might release them through the patient portal. I know that's generally what they've been doing more recently is releasing them a little bit earlier than you might typically get them through the patient portal. And so kind of figuring out how they're going to be delivered, when they're going to be delivered, so you're not constantly checking your phone and having your heart drop at every phone call, every ring you get. And then, of course, self-checking when possible will always help with some of that anxiety as well. If you have a random pain in your chest, but you do a self-check and you don't feel any lumps in your breast or anything, might still be worth reaching out to your oncologist, but more likely than not, things are pretty good. Some lifestyle choices, being active is a big one that we talk about, but I want to stress that being active does not mean that you're going to the gym, you're going to hot yoga, you're going for long walks around the neighborhood. Of course, you might not always feel up for that. It might not always be realistic with where you're at. So really being active is more just making sure that you're just even getting up and standing throughout the day, maybe moving around a little bit, just making sure that, of course, in line with where your current physical ability level is at, that you're maybe not just sitting all day on the couch, maybe getting up, moving a little bit. Even that can just be what being active looks like. Avoiding things that aren't making you feel better. I think this one's very important. A lot of, things that I hear quite often are something like, TV is so hard to watch now because every show has a plot line where someone gets cancer. And if that TV show is your favorite TV show and that plot line comes up and it's upsetting, but you still love the show, that's okay. You can still watch it. That's fine, as long as you're feeling like it's manageable. But if you're watching a show and this plot line comes up and it's kind of taking over the show and it's making it less enjoyable to watch, it's okay to stop watching the show. It doesn't mean that you're like succumbing to your anxiety because you stopped watching the show. The show's not that important to you. So if you want to stop watching it because it's not feeling good, stop watching it. You're not like losing the battle of the fear of recurrence if you're finding that something isn't feeling good and it doesn't make a big difference if you let it go and it's only going to make you feel better. Absolutely engage in that then. Of course, there are lifestyle choices that, again, have varying levels of evidence behind them. And it seems that things are like going back and forth all the time, like making healthy food choices, being active, getting a good amount of sleep, wearing sunscreen, cigarettes, safe sex, all that kind of stuff that you guys all already know. I just want to stress again that these are all things to do in moderation. And while they're healthy and important for not just people who have had a cancer diagnosis in the past, but also people who haven't, it's also important to remember that you don't need to have strict, perfect adherence to these lifestyle factors to avoid cancer. And if you haven't been in the past, it's not what caused your cancer, most likely. Moderation is always important. There are people who do none of those things and don't get cancer. And there's just an element of it that is, like I said, out of our control. So that's when we think about kind of more of viewing it as risk reduction with those unhelpful lifestyle habits rather than like full on cancer prevention, right? You might be reducing your risk, but it might not be total cancer prevention. So it's okay if, you're having sugar or you end up outside without sunscreen one day. That's not something that needs to cause you anxiety. As long as overall you're living a life that feels good for you. Because like I said, those lifestyle choices, while they're quote unquote in our control, again, they can also become that excessive worry. So strict adherence is no better than moderation for, risk reduction, and moderation is better for your mental health. So absolutely, by all means, I am of a moderation mindset. So now I want to shift into some self-care strategies and stress management strategies to kind of do like a little basic introduction into some of these things you can utilize when, you're feeling your anxieties come up, you have a scan coming up in the next week, and the worry tree is not cutting it. You need to kind of go to these more stress management strategies. This is very, very far from an exhaustive list of what is out there. But, I figure let's just get like a little basic introduction. I don't need to throw the whole book at you. And of course, there are different strategies that are going to work in different contexts, right? You'll see as we move through them, some of them would be safe to do while driving. Some of them definitely do not do while driving. Some of them may feel better when you're laying down, falling asleep at night, and some may be better when you're seated, kind of maybe, feet firmly planted on the ground. What you're going to find works for you is different for every single person, which is why we cover so many, because self-care and stress management strategies are most definitely not a one-size-fits-all experience. So I want to start out with guided imagery because it's one of my personal favorites. And if we have time at the end, I'll walk you through a guided imagery. So it's a type of meditation that involves intentionally thinking of a peaceful place or scenario. There, as the name suggests, being guided. Someone else, whether that be like an instructor from the Cancer Wellness Center over Zoom or a voice on a YouTube video, will provide the cues for what to visualize. Usually it's going to be something like a nice peaceful place, a nice path down a forest. And you're going to really use the 5 senses to imagine yourself walking through that space. It's worth mentioning that the Cancer Wellness Center does offer guided meditations virtually on Tuesdays at 1:15. Caroline walks through a guided meditation and she's great at it. But there are also endless amounts of YouTube videos on guided meditations that are great. There's also apps for your phone like Headspace and Calm that do guided meditations that are really fantastic. Also, once you kind of get the hang of the guided imagery, if you have your own sort of happy place, you can kind of do this yourself once you kind of get the hang of using those 5 senses to kind of imagine yourself really truly in a space. You can kind of take a happy place that you have personally, whether that be just like Lake Michigan, walking along the beach or whatever it may be, and really imagine yourself going through that space using the 5 senses, and having a more meaningful, personalized guided imagery, I think can be very helpful. And then you can use that during scans. If you happen to be in treatment, any time where you're feeling like your anxiety is a little bit heightened and you kind of want to distract your brain, maybe you've got racing thoughts, you just want to get yourself into a nice, more peaceful place. But as always with meditative practices, I like to stress that they are just that, they are practice. They are never going to be perfect, and that's okay. You don't have to have a single perfect meditative practice with no distraction or outside thoughts coming in for it to be useful for your mental health. I have yet to meet a person who can do just that. So, it's definitely a practice, but giving yourself the intention and setting up the intention of engaging in these types of activities can be really helpful in stress reduction. And I think if you are a person who tends to have more of those racing thoughts throughout it, guided imagery can be a great option over something than more like a mindfulness meditation where you're a little bit more on your own, because someone's giving you those cues and you're getting that voice externally that can help you focus in. So I love guided imagery. Another option are some body awareness techniques. I wanted to touch on 2 of them specifically because they're similar, but I think they have just enough of a difference to warrant covering both of them. So the first one is a body scan. So you're going to start at your feet. You're going to notice any sensations that come in. You might notice that your feet are feeling a little bit cramped, or that you kind of are flexing them. They're a little bit tense. And then you're just going to imagine your inhaled breath flowing right to your feet. So you're going to really envision that in your mind of breathing in and sending that breath to your feet. And then you're going to continue that going all the way up the body. You're going to continue that from the ankles to the calves to your thighs, etc., all the way up through your head. And on a similar note, but one that involves a little bit more physical activity, is progressive muscle relaxation, which again, you start at your feet, you breathe in, and then this time, as you hold your breath, you're going to squeeze that muscle that you're focusing in on for 10 seconds. So as you're holding your breath, you squeeze your feet for 10 seconds as tight as you can. And then as you breathe out, you just let all of the muscles in your feet relax. And again, you're going to continue this all the way up. So you would breathe in, tighten, squeeze your fists like this for 10 seconds. And then as you breathe out, let all of that muscles, all those different things in your hands relax. And you're going to move up to your head. Now, the reason that I cover these two, despite them being so similar, is one, personal preference. Some people might struggle to have the imagery of the breath going to the feet. That might not connect for some people, but also, the level of physical involvement in one is significantly greater than the other. I think progressive muscle relaxation is great if you find yourself having racing thoughts at night and you can't quite get yourself to go to bed. You're feeling a little bit tense. Progressive muscle relaxation is really great for laying in bed and kind of forcing your body to relax in that way. And then a body scan can be used more safely in different settings. Again, progressive muscle relaxation is one of those ones you're probably not going to want to do while driving, but a body scan would be much more safe to do in different settings since there's not that physical activity involved with it. But they're both great for really increasing bodily awareness and kind of forcing that physical calm in the body. And they can be used any time of day, although I do think there is some utility for either one. Box breathing is one of my favorite things. You might have heard of it before because people are talking about it more now, which I think is great. Box breathing is really great when you're in a more immediate, like acute stress situation. Again, might be cancer related. You might be walking into the hospital and you're remembering a lot of different things from treatment and you're getting really activated again and you need to utilize some box breathing. Or in your life, you might just be in an argument with someone and start to feel anger bubbling up. And box breathing is a really great way to kind of calm that too. So I like to use it in many, many settings in my life. So it's really great when you're feeling kind of more of those physical symptoms of anxiety as well, that racing heart, that stress, that nervous, angry energy. It can help. It kind of really what it does is kind of like force your body to regulate itself. So what it is like the name suggests, it's a box. You're doing each for 4 seconds. So you breathe in for 4 whole seconds, hold that breath for 4 whole seconds, breathe it out for 4 seconds, hold it out for 4 seconds. So I want to walk us through it so you can see how long 4 seconds feels, because it is a bit longer than it sounds when you just hear 4 seconds. So you would breathe in 2, 3, 4, hold it 2, 3, 4, breathe it out 2, 3, 4, hold it out 2, 3, 4. Breathe it back in 2, 3, 4. Hold it 2, 3, 4. Breathe it all the way out 2, 3, 4, and hold it out 2, 3, 4. So that's the exercise. It's as simple as that. You're regulating that breathing, you're forcing that breathing to slow down, but then there's also the nice mental distraction of you're counting to 4 in your head over and over again. And so if you've got those kind of racing thoughts, you're slowing them down by also counting to 4. So like I said, I use box breathing constantly. And there are a lot of different types of breathing exercises that are helpful as well. Just basic slow breathing, where you do 4 in, 4 out without the holds. That's more typical of like yoga type practices. They'll do 4 in through the nose, 4 out through the mouth. And then just extended exhales, box breathing. Try those out. See what works best for you. Some people don't like the holding part of box breathing, which is when that yoga breathing that just does the same thing minus the 4-second holds. feels better for some people. I personally really like the holds. So kind of giving them a try, maybe when you're walking into your next appointment with your oncologist or scheduling your next scan, giving that box breathing a try, I think can be very, very helpful in kind of forcing yourself to regulate and get back to more of a natural baseline. Now, I know this idea is not new, right? I'm not coming out with groundbreaking news here about using creativity in order to manage stress. However, it's effective, so I'm going to talk about it anyways. It's been shown to reduce levels of stress and boost self-confidence. Also, just even in the way of it serves as a distraction. If you're doing something you really enjoy and takes up mental energy, you have less mental space to think about other things that might be worrying you. And there are a ton of different creative outlets. I think most often we think of ones like performing, singing, making a beautiful painting. And that makes it feel some level of inaccessible to people like me who don't identify as particularly creative or artistic. This one feels like, oh, maybe this one's not for me. But there are very, very many different ways to use creative outlets. It can be something like cooking, which unfortunately I'm also not good at. But listening to music is something that I am good at. I can do that. And so that is still a creative outlet for me. Also, something that I've come to learn over time is that writing is something that does not have to be creative to be therapeutic. It can be just a 5-minute sprint where you're just writing whatever comes to your mind for 5 minutes straight, not stopping, not even worrying about grammar, just kind of thinking like, what's on my mind today? I'm going to write about it for 5 minutes straight. You can also Google writing prompts, so you don't even have to come up with what you want to write about yourself. And writing has been shown, even in just this 5-minute sprint type way, to reduce stress levels very effectively. The center offers a biweekly writing lab that can help kind of kickstart you with writing for therapy. If it's something that you think you might be interested in, I find it super helpful. I don't do it nearly enough, but every time I do it, I'm reminded of how powerful it can be to just kind of the act of getting it out of here and onto paper. And then I can do whatever I want with it. I can reflect on it and see how I feel. I can throw it out and never look at it again. There is like a therapeutic benefit to that in and of itself. So the big takeaway here is you do not have to be, a Grammy winning artist or a Tony winning performer in order to get benefits from creative outlets. Same thing with connecting with nature. Again, not a new idea, but something that I think people are hesitant to engage in because they're not quote unquote outdoorsy, right? They don't like bugs. They don't want to get a sunburn. They don't want to sleep on the ground in a tent. But there are many different ways to connect with nature than to go on a backpacking excursion, right? And all of these different forms of connecting with nature have been shown to decrease stress and anxiety. Simply looking out a window at nature. You don't even have to even physically be in it. Looking out a window at nature has been shown to reduce stress levels. There was a study that was done with patients recovering in a hospital, and those who had windows in their room recovered faster from their surgeries than those who didn't. So connecting with nature goes far beyond like fully 100% immersing yourself in nature. So it can be going for a walk just outside your neighborhood. It can be gardening in your backyard. It can be watching a thunderstorm outside a window. I love doing that personally. Just any way of, it's easy when you're not feeling great to just lay on the couch and watch TV. And that's nice too. I have nothing wrong to say. There's nothing bad about that. But also, it's important to kind of reconnect yourself with nature and get yourself outside every once in a while for fresh air, a little bit of sunshine. We know that vitamin D is great. And the center does offer many retreats and hikes throughout the summer that are great in getting you just kind of low they're not doing like strenuous mountainous hikes, but just through like more prairies around the area. Like they go to Middle Fork, Savannah, and Lake Forest often. And those are great ways to not only connect with other people who are involved with CWC, but also getting yourself connected to nature in a way where you don't have to do any planning. Someone else's job is to do that, and you just get to show up, which is the best kind. With all of these stress management strategies, like I said, and like I promised, ran through a lot of them. The most important thing to do is to listen to yourself in that moment. Like I said, there are contexts where some of these stress management strategies are going to be better than others. And some might feel better based on how you're feeling that day or what the specific worry or anxiety is about. So really, no matter what you choose to engage in, going through this process of listening to yourself, just stopping all your tasks and just focusing in on how you're feeling, listening to what kind of thoughts are going through your head, how you're feeling in your body. Are you feeling super tense? Are you feeling that pit in your stomach? Or are you just feeling more like you've just got these racing thoughts and they're not stopping? Validate anything you're feeling. Again, it makes complete sense why you're having these fears. You've had cancer once, so why? I mean, it could totally come up again. Understanding where you're at, and validating it's okay to feel this way. I understand why I feel this way, but also I'm going to try and do something about it, and making that decision of what's going to be best to care for yourself in that moment. Is that something, forget everything I just said. Is that something like going to take a bubble bath? Sure. Absolutely. Why not? If that's what's going to feel best in that moment, I'm all for it. Maybe it's that you're feeling really panicky and you're going to try that box breathing, or you're going to Google a guided imagery, trying to decide what's going to feel best and what feels most realistic for you in that moment as well. I talk about journaling with a lot of people that I talk to with the center, and journaling is not a one size fits all. So I also stress that I want you to use the stress management strategy that you're actually going to do. If you say, oh, yeah, I'm going to journal, and then you find yourself just at the end of the day being like, nah, I'm going to go to bed, actually, that's fine. That's fine. Journaling might not be the stress management strategy that's best for you. And that's okay. That's the kind of internal navigation we have to do of ourselves. Is a 2-minute box breathing going to do more for me than attempting to journal, but not actually really doing it, which is fine. You just got to be honest with yourself, and that's great. I will also say that journaling doesn't work for me either. So I've come to learn that there are many other ways that I can get my stress management in that does not have to be journaling. And so once we decide what that is, engaging in that activity and really cutting out the time, whether it be that 2-minute box breathing or a longer 10-15-minute guided imagery, engaging in that activity that you think is going to be best for you in that moment. But, self-care is great and fantastic, but it's also really important to recognize that prolonged challenges and challenges that feel kind of beyond the scope of what you might be able to manage can require professional support, which brings us to the incredibly important idea of self-help strategies. So the internet, it's great. We've been talking a lot about self-care recently. It's coming more into the standard vernacular, and we love that. But we don't talk as much about self-help. So the big difference is self-care is going to be a behavior that you engage in yourself that improves your mental, physical well-being. And self-help involves reaching out to others in order to help yourself. So self-help is not something that you end up engaging in alone. You're bringing in supports. So some self-help strategies that might feel particularly important in this case would be to contact a friend, someone you can call on, maybe it's not 24/7, maybe that's an exaggeration, but someone who within reason is going to contact you back pretty quickly, is going to understand if you call that, you need someone to talk to, and who gets it and who responds in a way that makes you feel good. Making an appointment with a therapist, whether that be at the Cancer Wellness Center or with an outside therapist that you enjoy, joining a support group or social network. Again, that might be like a more formal support group at the center, or like social networks. There's a bunch of support groups on Facebook that meet and post and support each other. And that's great too. If you identify as religious or spiritual, reaching out to whatever leader you might have who feels good to you, they can be a great support during this time as well. And then talking to your doctor or helping professional about medication, if it's feeling like it might be time to consider an option, whether it be like an anti-anxiety medication, antidepressant medication. This isn't for everyone. These medications are not shown actually to be particularly helpful for mild anxiety and depression. So really trying to decide, is this something that I think is going to be helpful for me? Is this beyond the scope of what talk therapy and stress management strategies have been able to do for me? And do I need additional support? Which is absolutely valid. You're going through a major stressor in life. And, sometimes medication is kind of that like missing link in all of it that can be really helpful in reducing those symptoms and boosting your mental health. So I would be remiss to mention that medication, of course, is an option if that's where you're feeling like you're at. I want to plug some CWC stress reduction events before I walk us through a little guided imagery, and then we do a Q&A, because there are a lot at CWC, and some are weekly, some are bi-weekly, but we have our stress reduction classes, which is when Caroline walks through a guided imagery. There's 45 minutes and they're really great. Sometimes I'll sit in on them because I just like listening to her voice, and it's very calming for me if I don't have a client during that time. As Lisa mentioned, we're starting the Introduction to Mindfulness course. It's in just a few days. It's on Thursday, which is great. And it goes kind of deeper into the mindfulness meditations that I didn't touch on so much. I focused more on guided imagery. So if you're interested in learning a bit more about that, that would be a great session to attend. There's also forest therapy for those impacted by cancer. I want to stress, because I know my pronunciation can be a little weird. Forest, Forest, not forest as in making you do it. It is forest connected nature forest therapy for those impacted by cancer. I've caused confusion in the past, so I want to make that incredibly clear that this is a voluntary therapy for those impacted by cancer in nature. And that is on Thursday from 1 to 3, or Tuesday, May 23rd. New to the center is Zentangle, which goes along perfectly with what I was talking about with that, like, I can't do creative expression. I'm not creative enough. Zentangle is more of a meditative drawing of structured patterns. So there's no artistic experience required. It's structure. You're not drawing anything yourself. And it's a great kind of like mindful activity that the Cancer Center has recently started offering, which I really enjoy. The biweekly writing lab that I mentioned earlier, they meet on Mondays at 11, and it's a great place. They'll, Dom, who leads it, will start us off with a little prompt, and everyone will write. Some people will share. And it's a great resource, not only to connect with others, but to get started in that writing kind of practice yourself. And then the weekly breathe in for strength and calm. If you were particularly interested in that box breathing, the extended exhale, the yoga breathing, this would definitely be the one for you. That's weekly on Tuesdays. It's just a quick 30-minute class, and really focuses in on some of those breathing exercises. If you want to learn a little bit more, get a bit more structure before you try and practice them on your own. So before we get into our question and discussion, I just want to take a second to do our own little guided imagery, so you get like a nice little introduction into what it might be like. So feel free to, like we do with our stress reduction classes, feel free to mute your camera and your audio, whatever you need to feel comfortable engaging in the activity. Whatever feels best for you and doing it is great. But first, I invite you to find a comfortable position, either sitting or lying down, with your head, neck, and spine aligned. Uncross your legs and let your hands rest quietly in your lap or by your sides. Loosen any tight clothing and gently close your eyes. Begin by taking a few easy breaths, breathing in and all the way out. Breathing in, and this time, see if you can send the warm energy of the breath to any part of your body that is tense or sore or tight, and releasing the tension with the exhale and breathing it out. And any unwelcome thoughts that come to mind, those too can be sent out with the breath, released with the exhale, so that for just a moment, the mind is empty, and any emotions that are floating around in there, those too can be noticed and acknowledged and sent out with the breath, so your emotional self can be still and quiet, like a lake with no ripples. And now, imagine a place where you feel calm and peaceful and easy. A place either make-believe or real, a place from your past, or somewhere you've always wanted to go. It does not matter. A place that feels good and safe and peaceful to you. And allow the place to become real to you. Look around you. Take the place in with your eyes. Enjoy the colors, the scenery. Look over to your right and over to your left, and listen to the sounds of the place, wherever they might be, becoming familiar with all the different sounds that your special, safe place offers up to you. Feel whatever you're sitting against or lying upon, the texture of the ground beneath you. Feel the air on your skin. Notice the temperature of your place. Smell its fragrance. Notice the smells in your special place. Notice what time of day it is. Enjoy that light and the peaceful time of day. Take it all in, all of the richness of it, with all of your senses. Become more and more attuned to your safe and beautiful place, feeling thankful and happy to be here. Let your body soak in the vibrance. Let the beauty of this place of healing nourish you. Take it in with every full, deep breath, all the way down into your belly, all the way down to the tips of your toes, feeling the penetrative warmth and power of the place, soaking into your skin, down through the muscle and bone, all the way to each and every cell, reaching down to the peaceful stillness at your very center. And so, know that you can come back to this place whenever you wish to help your body, mind, and spirit relax, rejuvenate, and heal, simply by finding a quiet time and space and imagining yourself in your special place. Keeping your eyes closed for just a little while longer, taking a moment to notice how you are feeling, your body, your mind, your spirit. Once again, feeling yourself sitting in your chair, breathing in and out rhythmically and easily. Slowly coming back into the room, opening your eyes whenever you are ready. All right. Thank you for joining me on that. I'm curious, does anyone have any thoughts about how that one kind of felt? I know there's a bunch of different kind of guided imageries, but I'm curious if anyone had any thoughts stick out to them about that specific guided imagery and how it felt for you.
Yeah, Rebecca, I'll go ahead and comment. I think it's really helpful. It's just something that I struggle with perfecting, but you say don't worry about it.
Precisely. Yeah. Yeah.
I
Like,
think I always put a lot of pressure on myself because my mind wanders so much that I feel like it's not really helping, but I think it is helping. But I think I just need to practice more. Do you recommend like every day, or do you have a?
yeah. Yeah. So I personally, although I know it can be hard to stick to, I do recommend um a once a day guided imagery. That one was one of the shorter ones they offer, which is why I chose it. Kind of 5 minute to 10 minute ranges is about as short as you're going to find for a guided imagery. But so whether it be every other day or, even just a few times a week, it is a practice in the way that it will get easier too. So not only will a practice mean it's not going to be perfect, it's a practice in that it's a skill to build as well. So certainly over time, guided imageries and meditations in general do tend to get a bit easier, although that will again change if you're at a time when you're feeling particularly anxious. Might not feel as good as the day that it did before, but know that it's still making a difference.
Thank you. Thank you so much.
Yeah, of course. Thank you for sharing, Susan. All right. I want to move us into our questions and discussions so that we can stop with the recording and have others share, without feeling like they might be recorded, and I can address some of the stuff in the chat. So let me make sure